Next, we have Keldork Global Innovations. They are into addressing health challenges in Ghana's mining communities with a KGI app, offering affordable telemedicine services for HIV and non-communicable diseases. The app provides drug delivery, personalized AI-powered medicine, and equally reduces stigma through fever hospital visits. Keldork Global Innovations. Ladies and gentlemen, let's put our hands together for Kekeli Yao.
Hello everybody, I am Kekeli Yao Dorkenoo. Judges, I want you to just ask yourself one question. If today you tested positive for HIV or a non-communicable disease, how easy would you find it to visit your hospitals every day for the rest of your life? How easy would you find it to take drugs for the rest of your life? Would you find it easy to remember? Come with me. Good. So, persons living with chronic conditions in Ghana are faced with difficulty in their healthcare management. Now, climate health is another big deal because due to illegal mining, we have climate health issues in some of these zones. Now, this problem that we've identified borders on three things: inaccessibility due to the high cost of transport to hospitals. We also have time constraints because in Ghana, the average waiting time in a hospital is around 1 hour in terms of the government hospitals. Also, we have long distance or viral load laboratories are quite far from most of these health centers. Secondly, we have issues with inadherence. Due to forgetfulness, you would realize that sometimes your doctors tell you take this 3 times a day, and sometimes you tend to forget and skip dosages. Again, we have ART drug side effect, which makes some of these drugs that the patients are taking quite very difficult for them and uncomfortable to manage. The drug measurements too are quite complex for them to take. Lastly, we have the stigmatization issues, not from the populace alone, but from the health workers themselves. And also we have social isolation issues. Now, for you to get a clear idea of how big this problem is, currently we have 755,000 plus persons living with HIV and non-communicable diseases combined in Ghana. HIV alone has an infection rate of 20,000 persons per year, so the figures keep going up. Out of these figures you are seeing, 13,000 people die of HIV every year. And just like one of the pictures said, non-communicable diseases, kidney and co, counting for 45% of mortality rates in Ghana. What then is the solution? With our current government and other governments championing digitization, we are coming up with a digital health product, which is in the form of an app and a USSD platform to specifically tackle the first 3 issues that I mentioned. So in terms of inaccessibility, we are going to solve it with last mile drug delivery services, where we are going to use eco-friendly logistics services to deliver drugs to the comfort of their homes. Based on the government providing a resource called Lightwave Health Information Management System, we can simply use integration to offer remote drug request for patients, and the doctors can remotely communicate with them. One of the core themes of this E-Jobs4All is economic empowerment. Indeed, high cost of healthcare in Ghana causes what we call catastrophic health expenses, which comes in the form of transportation, just to name a few. We also have virtual nursing in the form of AI-powered personalized medicine, algorithm-based, and we will be curbing the stigmatization issue through our U is equal to initiative, and then our app will be biometrically locked. Our business model features a $3 subscription fee, which will be paid monthly, quarterly, semi-annually, or annually based on the customer preference. Our market research indicates the average cost of treatment in a hospital in terms of transport and co is around $8, whilst we are taking $3. Our unique concept features eco-friendly delivery services, AI-powered personalized medicine, as I mentioned earlier. Our market analysis indicates that in Ghana, we have a total addressable market of 350,927 HIV patients, because that's our beachhead market. Now, out of this, our sum would be 70,000. That is persons who are 18 years and beyond, who have access to smartphones or YAM phone, as we call it, because we have USSD platforms too. So as a startup, we are using a 63% adoption rate, which will bring us to 37,000 patients per annum, giving us a revenue of $1,322,000 per annum. Our go-to-market strategy includes social media campaign, which is already ongoing. We also have a partnership with stakeholders, visit to hospital, and also partnership with HIV support groups and the Ghana Non-Communicable Disease Alliance. Our competitors include Glyco Group and Levent Technologies, and we stand to be different with our integration, last mile services, Eco Currency funded, which is one of our Eco insurance we are bringing up. Our break-even unit requires us to get 19,000 patients, 573 to break even. You can see our cost, including our transportation, utilities, just to name a few right over there. Our revenue projections, indeed, we have a startup, not a venture. So we plan to, with a 12% growth rate, get 300 patients per annum, and in the first year we can make a profit of $36,000. Our traction, last year we were adjudged first runner-up winner in the German Falling Walls Lab, and also the first ever Ghanaian to be selected in the German Exist Fund Accelerator. This year we've been adjudged the entire Africa Ecosystem Startup Builder of the Year, which was also part project by NEIP. This is the German ambassador awarding me, and this is the recent ASEP Awards. In conclusion, we plan to tackle economic empowerment because this digital health initiative will create indirect and direct jobs. Also, we are also ensuring good health, which is one of the priorities that we need if we want people to live well. We will be also reducing inequalities because chronic conditions are stigmatized. And lastly, youth preservation, because majority of the youth are the people who are infected. This is our ask. Majority of it will be going into our product development, which is around 40%, and the rest are right over there. This is our team. With me, a certified Germany Africa consultant and 2 CTOs who have masters from South Korea and Germany in IT development. And this is Yvonne Ahili, West Africa SMEC PTY HR. She is in charge of our human resources. And I'll end this with a call to action that E-Jobs4All looks at 3 things: youth preservation, economic empowerment, and protection of the environment. Let us throw our hands behind this digital health initiative so that we can achieve these goals. Thank you.
Perfect, I can start us off. So my first question is, can you tell me more about the traction so far, sure, and if you have any success metrics on increased drug delivery, etc.?
Sure. Where do I turn it to? Hello. Okay, it's on the slide. That's why I want to use the slide. Good. So when you look at our traction 2023, right, we tested our MVP with 100 patients. Prior to that, to what we're doing with their consent, we're going to pick up drugs at the comfort from the hospitals on their behalf for as little as $30, which is for as little as 30 Ghana cedis, which we've indicated. Also, we've been able to penetrate the African markets through what we organized industry events, which is the Climate Health and Digital Health Innovation Week in Ghana. We're the first to do that. Also, when you look at the bottom, we have Digital Health Week celebration coming up in November, organized by us in partnership with Transform Health to ensure that we are able to penetrate the Ghanaian and African markets. So that is how far we've come. And then we are in this year, we have been able to continue building our products. Yeah.
Perfect. Thank you so much. And then
sure,
the last question is, I saw on one of your slides you said that you have eco-friendly delivery services. Can you tell me what the eco-friendly part of the delivery is?
Thank you very much. Okay, so in Ghana, we have something we call e-mobility, which is being championed by Wahoo, Valerie Labi, my friend, and LSA. So they basically use e-bikes to do delivery, logistics delivery. So we are not going to use motorbikes that use fuel. We are going to outsource our logistics services to companies that use eco-friendly delivery service, means of transport. Yeah, that's what I meant. Sure. Yeah.
You said you have to subscribe to the app. Is it $3 a year?
No, it's 30 cedis per month. We use dollars to ensure that when we have foreigners, they can get what we mean. But it's 30 cedis per month.
Okay, so the $3 is $3 per month?
Yes, per month.
So you're using an exchange rate of 10 cedis?
Yes, I indicated it there.
Why?
Yeah, so we constantly use that because that is the figure we want to use. We want to use 30 cedis, but for sometimes when we are pitching, investors sometimes or foreigners don't get the currency conversion.
So you have a fixed exchange rate?
Yeah, we have that. Yeah, we have it there. I put it on the. How does?
It's fine. Don't worry.
Yeah, sure.
Did you present in terms of income demographics of people living with HIV/AIDS?
When
Did you present anything on that?
income demographics?
Yes.
On the part of the patients?
Yes.
No, we presented on the age 18 plus and beyond.
Okay. Have you had any research on the income demographics of people living with HIV and whether they can afford this product?
Yes, indeed. So you see the problems are identified. The high cost of transport to hospitals. So it is true that we got to know that they incur higher cost, which is around 80 cedis, because it may be affordable for you, but someone who is living far away, all right?
So they incur a cost of 80 cedis per month to visit
No,
the
so it's
hospital?
an average. No, so you may be visiting hospitals, you get me. When it comes to this disease, the doctor can say, go and do your lab here, go and do this. So on an average, you are looking at 80 cedis. Also, we are looking at the time, they spending time that they will eat and so on and so forth. Yeah, so they don't have much of a choice. So we are even bringing it down.
Is the app running?
Yes, so right now we are expanding it. We ran an MVP.
How many people are on the app now?
100, we just used 100, like I said, 100.
Okay, so the 100 people, how did they pay for their subscription?
Or they just use mobile money.
Okay, can you please give me the name on the app?
No, so what I mean is we didn't put it on Goose Play. We were testing. I indicated that it's testing.
You've tested it?
Yes, with them,
So
testing.
they did not have to pay?
No, so they paid. It's 30 cedis. You just go and pick up the drug
Sorry,
and go and give it to them.
I'm confused.
Yeah.
You are testing the app,
Yes.
right?
Yes.
So the people you are testing with, they have to pay to be on
For
the
the
app.
logistics services. They pay for the delivery. The usage of the app for you get me, personalized reminders, those things are free. Is that the logistics you are paying?
Okay, so when you register for the app,
Yes.
you don't pay anything.
No, you don't
When
have to pay.
you are ready to have a medicine delivered to
Exactly.
you. So if in the month I'm not going to have any medicine delivered to me, does it mean I don't pay?
Yes, you don't pay. And the reason why that is sustainable is this. I highlighted chronic conditions. So HIV like this, you have to go to the hospital every month to get your drug. You don't have much of a choice. When it comes to kidney and so it's the same thing. You have to constantly be going to the hospital every month for these drugs. So
And there is research to show that if I go to the hospital once or every 3 months, I will not be able to get my supply for the 3 months. I can only get my supply for 1 month.